Nova Scotia Health is more than 1,000 nurses short. NSGEU nurses working at Halifax hospitals are desperate for help. Nurses may face serious consequences if they speak out. We have concealed their identities so they can tell you their stories in their own words.
Well, we're down here trying our best, and it's not good enough. Our best is not good enough. We've had incidences where we've been short-staffed and, patients at night, we could have, 10 confused patients, and they fall, and they hurt themselves. We've put in the safety precautions, but, you can't be everywhere at once. And it's terrifying, and it makes you feel awful as a nurse because your responsibility at the end of the day is to care and take care of these patients, and you feel so awful when you can't do that. Hospital-wide, you could be 3 and 4 nurses short on a night shift or a day shift, and, people just expect you to work that way. And you're like, how can I be responsible? We have a license to practice at the end of the day. Patient safety is a huge part of, what we do on a daily basis. And you're like, here I am, expected to take care for, could be 10 patients on these days where you're so short. I don't want to take on the responsibility of this because if something happens to these patients, it's on me. If you're 1 short, you're like, it's a win. And that's just the norm they've created. Before, if you were 1 short, you might get help. Now, if you're 1 short, they don't even want to hear it. They're like, oh, if you're 2 or more short, then let us know. And we might be able to find somebody to help you.
Isn't that kind of the most fundamental problem that you have?
I keep harping on staffing levels, but essentially that's the biggest thing. We work on a unit where on a typical day shift there should be 9 nurses, and on a night there's 8. So the days that we're fully staffed, which are few and far between, you can guarantee you're not going to be fully staffed because you have to float to another unit. It's the norm within the hospital. It's the environment that they've created that every unit can work 1 short. So if you're fully staffed, forget it. They tell you to make an assignment based on being short because you can guarantee you're not going to keep your staff. Then people are annoyed because they come to work and they're like, great, I'm floating again.
Just for anybody who's not a nurse or doesn't work in healthcare, what does it mean to be to float as a nurse?
So essentially, you're going to another unit where you have no training. Typically, when you're working as a nurse, you go to an area that you have an interest in. You become normalized to the procedures and tests and medications that are specific to that population. You then get floated, so you're moved to an area. You have no idea the layout of the land. You don't know where anything is. You don't know anybody, let alone know what procedures or tests that are going on with these patients. Medication specific to those areas, you don't know. You don't know the doctors. You have no idea who to turn to when you need help. And it takes you a lot longer to do anything because you don't know where things are. You don't know what's being done. You're researching the medications you're giving. You're spending your whole day just trying to get ahead when you can't. So you're just thrown to the wolves when you go